So now we are on the daily evaluation. This starts on page 36 of the nursing document. All the assessments and care plans are completed on admission, and then the care plans are reviewed on every shift. This is where we do our daily documentation, our daily evaluation. So no blanks should remain on this page. Draw a diagonal line where care plan is not active. Insert E and document an evaluation of care if variances in care occur. Okay, so this page is where we have all our care plans listed and our codes. However, if we need to evaluate on our care, then we will go to the next page, and this page is just directly opposite it. So this is where we document our evaluation of care. Okay, so I'll just go back up here to explain this. So we have space here to document the date, the time in the 24-hour clock, and the shift. So this is for the night shift, the AM shift, and PM shift. And then this is for the night shift, AM shift, and PM shift. So effectively you have 2 days worth of documentation here. Okay. So it is divided again into the 12 ADLs. And you will notice these numbers down the side. So these numbers all correspond to the care plans. So if you remember when we were going through the care plans, each one of those were numbered. So these correspond to the care plans. So the first one here, maintaining a safe environment. Okay, so we'll just read through this. Identification banned in situ and clearly legible, and patient well-being facilitated equals 1. Okay, so if that's the case, we put in the 1 in the box. So if there is a variance to this, if this is not the case and we need to document something, we go to our evaluation. We put in our date, our time, the problem number. So the problem number here was 1A. So we write in 1A and we write our evaluation of care. Okay, and we put in our signature. So for the second one here, 1B, patient alert and orientated to time, person and place equals 1. So if that is the case, we put a 1 in the box. However, if it is not the case, perhaps our patient is confused today. So we'll get our problem number 1B and we just go to the next page. And remember, this page in real life, this page is directly opposite the first page. So you put in your date and time, your problem number is 1B, and you can say your patient, the patient's name, it has been confused today. Team have been contacted to review the patient, and put in your signature. Okay. So really anything you're writing here is anything that's outside of the norm. Okay. 1C, falls care plan, interventions followed equals 1. Okay, so if you have completed your falls care plan and activated the appropriate interventions, if you put a 1 in the box here, that's you saying that you're carrying out those interventions, that you're providing that care. Okay, so you're just putting a 1 in the box. If you have not activated the falls care plan, if it's not relevant for your patient, then just put a diagonal line in the box. Okay, don't leave it blank, just put a line through it. So 1D, other risk factors in relation to maintaining a safe environment, and you can write in what that is. Have they been re-evaluated? So if they have, you put a 1 in the box. 1E then is patient prepared for theatre or procedure is 1, and specify what that is. You know, maybe they're going for surgery, maybe they're going to endoscopy, whatever it is, and you put in your 1. If you want to put an evaluation, you could put in your evaluation, and you could come down here and you could write your problem number 1E. Patient is fasting for surgery, awaiting team to consent patient, or something like that. So the next section then is communication or pain. So 2A, patient has the capacity to communicate needs. So if that is the case, put your 1 in the box. 2B then, all pain control is acceptable to patient and pain score documented in news at least 12 hourly. If that's the case, you put in your 1. All pain must be re-evaluated and documented within 1 hour of administering an intervention. Okay, so if your patient is having high levels of pain, you would put your evaluation in here. You would write your date, your problem number 2B. You know, patient is complaining of a pain score of 8, analgesia administered as prescribed, and then you have to come back and reevaluate to see if that analgesia has actually worked and document what their new pain score is. So then we're on breathing and circulation. News or IMUs recorded and is within normal limits equals 1. So if it is, put in your 1. If it's not, then you need to do an evaluation on it and what you did about it. The ISBAR tool should be used to alert and report the deteriorating patient, then documented in evaluation of care. 3A, oxygen administered as prescribed is 1. Okay, if it's not relevant for your patient, just put a line through the box. Patient received nebulizer is 1. Patient received inhaler is 2. Steroids is 3. Okay, so your patient may not be on any of those, just put a line through the box. Your patient may be on all 3, so you can write in 1, 2, 3. Circulatory cardiac care plan interventions equals 1. So again, if you're putting a 1 in the box, you're saying that the circulatory cardiac care plan has been activated, and those interventions that have been activated, you're carrying them out. If your patient is on telemetry, you can put a 2 in the box. INR within set parameters. So if you are monitoring your patient's INR, you can put a 1 in the box. If it's not relevant for your patient, put a diagonal line. Eating and drinking or nutrition and hydration. So food chart recorded is 1. IV fluids as prescribed is 1. IV antibiotics is 2. Blood products is 3, and other, so you can write in whatever it is 4. 4C then, fluids. So if they are on level 0 fluids, you document a 1. If they are on level 1 fluids, you can document a 2. Level 2 fluids, you can document a 3. Level 3 fluids, you can document a 4. Level 4 fluids, you can document a 5. Okay, so just be cautious with this one. It can be a little bit confusing. So the number you have in the box isn't the level, it's the code in relation to the level. So if you see a 4 in the box, it's not level 4, it is actually level 3. Okay, so just be cautious in relation to that. 4C then is diet. Is the patient on level 7 is 1. Level 6 is 2, level 5 is 3, level 4 is 4, level 3 is 5, and special diet is 6. So if they're on a special diet, then you specify perhaps it's a diabetic diet. So again, be cautious here that the numbers here, they refer to these codes, not the level. Okay, so if number 2 is written here, it's not level 2, it's level 6. Okay, 4C then is the patient, are they able to feed themselves? So that's 1. Do they need partial assistance is 2. Supervised diet is 3. Full assistance is 3, and fasting is 4. Okay, so please note there is a typo here. As you can see, supervised diet is 3, full assist is also 3. Okay, so please be cautious in relation to this. I would advise you to put an evaluation in the box here, come down here to 4C, and just to clarify what it is, just to write it. Okay, and that will be updated on the next update. 4C then, blood sugars monitored and stable is 1. Okay, Elimination then, 5A, urinary elimination is the patient voiding is 1, incontinent 2, commode is 3, urinal or bedpan 4, and catheter care given according to care plan is 5. So if you are documenting 5, make sure that the catheter care plan is completed, and remember that your catheter care plan is also your catheter care bundle. 5B, bowels moved is 1, unopened is 2, incontinent is 3, stoma acted is 4. And then the type according to the Bristol stool chart. So you write in the type, okay? And if you go back to your elimination care plan, there is a Bristol stool chart there for reference. Number 6 then is personal cleansing and skin integrity. So 6A, self-caring is 1, assisted is 2, bed bath given is 3, shower given is 4, and shave given is 5. Oral membranes intact, self-caring is 1, oral care plan interventions followed is 2. So again, if you're putting 2 in the box, make sure that you have the oral care plan activated and the interventions activated. 6B, the patient's Waterlow is less than 10 is 1, okay? Waterlow 10 or more, then a daily skin evaluation to be documented. So there you have to put in your evaluation. If your patient has a Waterlow score of 10 or more, then you need to be commenting on the patient's pressure areas. So you put an E in the box, and your problem number is 6B. We come down here again, 6B, and you can say patient's pressure areas are intact and sign it. Okay, so that has to be done every shift. So please ensure to go back to your Waterlow assessment and check what their actual score is, and make sure that the Waterlow has been updated as necessary. So 6B then is the patient independent, that's 1. Has the patient been repositioned 1 to 2 hourly? That's 2. 2 to 3 hourly is 3, and 3 to 4 hourly is 4. So put your code in the box. 6B, patient sat out on chair is 1, nursed in bed is 2. 6C then, wound dressing renewed as per care plan is 1, dry and intact is 2, date due, you can document the date that the dressing is next due, and then drain care plan interventions followed is 3. So 7A and E, nursed as per infection control policy is 1, so you can specify what the infection is and what type of precautions the patient is in. 7B, temperature within normal limits is 1. 7C and D, IV cannula in use is 1. If it's not in use, medical request needs to be documented and the cannula needs to be flushed 12 hourly. So if that's the case, you're putting in a score of 2. And if it's a central line, then 3 is your code, and then the day, how long has the central line been in. 7C then, cannula site or sites are documented here, and then the date they were inserted. Document VIP score every shift. So in this box here, we put in our VIP score. And when I went through the care plans on infection control, I went through the VIP assessment if you want to have a look at that. Mobilizing then, so 8A is the patient mobilizing independently is 1, assisted by 1 is 2, assisted by 2 is 3, full hoist is 4, and sit to stand hoist is 5. Patient ambulating using Zimmer frame is 1, stick is 2, other is 3, and you can document what other is there. 8B, DVT or PE care plan interventions followed is 1. So again, if you're putting 1 in the box, make sure that your care plan and interventions are all activated and up to date. So 9, 10 and 12, working and playing, recreation, expressing sexuality, body image, spiritual needs and discharge planning. We put these all in together because some of it overlaps. So 9, 10 and 12, opportunity given to patient or family to voice concerns. No concerns is 1. So if they have no concerns, you can put a 1 in. If they have concerns in relation to anything, you can put an E in the box, and then you can write here in more detail. 12B then, care given as per end of life care plan is 1. So you put your code in there. Sleeping. So patient either they slept or they slept intermittently. You put your code in, and if there's any issues in relation to sleeping, you put your evaluation in and comment on it. So these ones here in red are very important. Number 14, care plans are evaluated daily. All activated nursing interventions outlined are administered equals 1. So by you putting the 1 in the box, you're saying that you have reviewed and evaluated all the care plans, and all the interventions that are activated on those care plans, you have carried out that care on your shift. All supporting end of bed documents are completed and up to date is 1. So if you're putting the 1 in the box, that's you saying completed your fluid balance chart, your food chart, etc. Anything else that might be at the patient's bedside. 16, medications administered as prescribed and new medications or changes explained to the patient or family is 1. Discharge plan, this must be reviewed or updated daily is 1, and the planned date of discharge, you can document that there. The initials of the registered nurse, and make sure that you have completed the signature record on the very front cover of the document. You put in your initials there. So if it is a nurse who's not registered, such as a student nurse or an international nurse, please complete the signature record also, and they sign there. Okay, so they need to have a co-signature from a registered nurse. So sometimes when you complete this, you will find that you might have nothing written here, and that's fine. Other times you might find after one day this whole page has been filled in, and that's fine too. So it just depends on what is happening with your patient on that day. So if this page is full and you have just one day completed, we'll say, then just leave this. You can just put a line through this, and then you can start again then on the next page.